Hello, this is Dave Snell with Executive Restoration, and I have a very, very special guest with me tonight, and his name is Dr. Arthur Cushing, and he owns Holistic Doctor of Charlotte, and his office phone number is 704-776-4185, and his website is holisticdoc.com. Is that right, Dr. Cushing?
That's exactly right.
Okay.
Yes, thank you, David.
Oh, you're welcome. So I just wanted to give you an introduction. And without further ado, before I say anything else, this is somebody that I believe in. This is somebody that I've known for 10 years. And this is somebody who has really taken care of me through my experience with my back problems, folks. So here is Dr. Arthur Cushing.
So, I think we're here to talk about mold. Is that right, David?
Oh, we're here to talk about you. We're here to talk about you and what you do and how you can help others. And I'm going to make this all about Dr. Arthur Cushing and not about Dave Snell.
Okay, well, thank you, David. It's a pleasure working with you, and it's nice to be able to tell your audience a little bit about what I do. Basically, I've been in business for more than 40 years. I have 2 doctorate degrees, and I patented and trademarked a method of allergy desensitization called Allercies TM. This is a bioenergetic technique that has been proven very successful over the last 40 years, by which we can desensitize people to virtually anything, any kind of environmental allergen, any kind of food allergen, or chemical allergen, or pet, or certainly any kind of mold or mold spore issue. This particular technique that we use at our clinic in Charlotte has been tested and proven in Florida with the help of 2 veterinarians on many animals, dogs, cats, and dogs. We have some amazing pre- and post videos showing the effect of our Allercies technique in desensitizing dogs and cats and dogs to a wide variety of foods, environmental agents of all kinds, things like flea bite venom, just all kinds of things. A lot of people don't realize that one of the major problems with animals is that they're highly allergic to many of the foods that their owners give them. They're often fed inappropriate foods. They get terribly sick, terrible skin rashes. And of course, when they go out in their backyard or go for a walk, they're eating grass that's been sprayed with pesticides and insecticides and fungicides. And so many of the animals that we've taken care of have been rather, it's been like torture for them to exist. So we are very happy to be able to desensitize them and give the owners some idea how to properly feed and take care of their animals. But most of all, it was the desensitization so that they could eat and drink and live in the environment without constantly reacting and constantly having skin issues. Some of these animals, just were terribly, their skin, they're so itchy. They scratched until they bled. Their skin looked just absolutely horrible. Well, I won't go on and on about that. That's just a little bit of my past history. I decided I wanted to prove the Allercies technique on animals. I was asked to do so by a couple of veterinarians. We did that successfully. But now in Charlotte, we function as a holistic doctor, but I would say probably 40% of what I do is allergy desensitization. So the kind of cases that we see are very varied, because a lot of people with chronic illnesses have a significant allergic contribution to their illness. They don't realize that the foods that they're eating are contributing to their chronic illness, their autoimmune diseases, their leaky guts. They have no idea. And of course, now it's spring, in Charlotte, or about to become spring in Charlotte. So we're going to see a significant number of cases of pollen allergy, weed, grass allergies, shrubs, flowers, etc. And these are very successfully handled with this unique technique. By unique, I mean it's very different from the classical medical model of allergy evaluation and treatment. As an example, dust and dust mites, which is a fairly common allergen and creates difficulty with a number of people, with creating sinus problems and tearing in eyes and nasal issues. This is an example of the Alice's technique. This is something we desensitize the patients to in one treatment. So it's not unlike the medical techniques, which involves usually injections of one sort or another twice a week for maybe a year. Our technique allows us to effectively desensitize anybody to, like, dust or grass or weeds, as an example, any of these things in one treatment.
How about mold?
Mold is usually one treatment. Occasionally it is two treatments. Occasionally mold takes two treatments. Not everything is one treatment. Most everything is, though.
Okay.
Mold, it depends if they've already inhaled the mold, if it's already lodged in their lungs, or whether they're just reacting to the mold spores in their environment. So with if they're reacting to mold spores, we have in a frequency form all of the mold spores, Aspergillus, Penicillium, etc., all the mold spores. And so we can easily identify the particular mold spores that they're reacting to and effectively desensitize them so that when they breathe them in, they no longer have an inflammatory reaction. They no longer have a histamine reaction. They're effectively free of mold allergies. This usually takes 1 to 2 treatments and is a remarkable outcome for these patients.
I know there are a lot of homes where I go in, Dr. Cushing, and people have serious problems with their homes or businesses, and they're taking all these drugs for all these problems. And I tell them, I was like, you really need to get this resolved with your body, because we may get your house taken care of, we may identify your problem, but we've got to take care of the source of the problem. So we can take care of their home. I can take care of their home, but if their body is still has issues, will it continue to have issues until it's taken care of, their body?
Yeah, of course, it depends on the nature of the issue, how long they've had it, the depth of the issue, contributing causes to the issue. But our philosophy is to get to the cause of the problem, not to use any Band-Aid treatments. Not that people don't occasionally need symptomatic treatments, but in and of itself, symptomatic treatments continue to be symptomatic treatments forever until you get to the cause. So in many cases, we do both at the same time. For instance, if somebody comes in with severe food allergies, we will desensitize them to the foods, usually the protein component of the foods, but not strictly limited to that. But at the same time, we'll be looking at the lining of their gut to see if they have a leaky gut, to see whatever else is contributing to the food allergy syndrome that they're suffering from. So it can get a little bit complicated because it goes beyond the medical model of treating for food allergies. The medical model for treating for food intolerances, food allergies, and hypersensitivities is primarily avoidance. And although that sounds like an easy thing, it's not easy for the people to avoid basic foods in their diet. And many of the people that we see who have rather severe food allergies are actually reacting to the vitamins and minerals in their food, not just the other things in their food. So when we see somebody, it's a fairly comprehensive workup. When we see somebody for food allergies, as an example, we will test them not only for the foods, but also for the components of the foods. It could be the salicylates in the foods, the phenolics in the foods, the vitamins in their foods. We'll check for acid-base issues affecting them. So in addition to desensitization, we try to correct the underlying problem that brought the whole issue out as an allergic phenomenon.
Okay. Now, does insurance cover this? Does insurance cover this?
That's a good question. I'm often asked that. Insurance will sometimes cover any lab testing associated with it, but the actual treatment itself is almost never covered by insurance. And the reason for that is that it's not part of the medical model. It's not part of the medical pharmaceutical model. So there's no insurance codes that describe what I do. It's a holistic model. It's something we developed and patented and proved successfully over the last 40 or so years. But that doesn't mean the insurance companies will accept that. They only really accept the medical model of allergy treatments in terms of reimbursement.
Right. And I want to tell my listeners that Dr. Arthur Cushing is my hero. And I'm going to tell you why he's my hero. And I have never said this to him, not that I can remember anyway, but I'm going to tell you the reason he's my hero is because he was able to figure out what was going on with my body. And I'm able to walk today because of Dr. Arthur Cushing. I was bedridden twice. Last year and the year before, and he diagnosed my problem, and I am walking today because of Dr. Arthur Cushing. So not only do I give him the thumbs up, but I give him 5 stars. And he is an awesome man. He's a very honorable man. He's a very kind man. He's a very gentle man, and he is somebody that all of you can trust who know me. So I endorse Dr. Arthur Cushing and what he does to help others, and he is just a wonderful man.
David, that's so kind of you to say that. Thank you. And I would just like to say just a little bit about you, even though you didn't ask me to do this. But you also are very straightforward, very honest. A client can totally trust you. You're very thorough. You know your business backwards and forwards. That's why I refer patients to you who need like mold remediation and mold evaluation in their homes and offices, because I'm totally convinced that you're the right person in Charlotte to do that.
Well, and just, Dr. Arthur Cushing, I'm so passionate about what I do and offer, and just as you are so passionate in what you do. And it's just like a couple days ago, I was out doing an inspection in the snowstorm that we had. It was Thursday night, and I was on my way out of town to do an inspection. And the family was very, very sick. And I told them about you, and when I go over their lab report tomorrow or Tuesday with them, I am going to tell them to call you. And you're the first person that comes to mind in helping others. And I just want to thank you. I've known you for 10 years. I just want to thank you, Dr. Arthur Cushing, for not only for what you have done for me, but for so many others. And thank you so much.
If you could see me now, I'd be blushing, but that's very nice of you. Now I have to live up to all of that, David, but thank you.
Oh, you have always lived up to that and more. And I want to tell you, folks, that I didn't know where to turn. I really did not know where to turn when I was bedridden. And I just thought this would get better on its own, and I didn't know what to do. And so when he diagnosed my problem, I had are they called bulging disc?
Yeah, protruded.
Yes.
Bulging disc. Yeah.
So when I had bulging disc or protruding disc, and I was just in so much pain, and I reached out to Dr. Arthur Cushing, and he came to the rescue. Folks, there are not too many people in my life who have come to my rescue. And I cannot say enough about Dr. Arthur Cushing. He is the man. He is the man that you need to talk to, that you need to go see, and that you can trust. And Dr. Arthur Cushing is just, I tell everybody I know about you. All the homes that I'm in and the businesses that I'm in, and people have issues with asthma, with breathing issues, and they have these mold issues, and they're so used to taking chemicals. They're so used to taking drugs. They're like, Dave, my doctor told me that I should be taking such and such. And I said, listen, just be open-minded. You need to talk to Dr. Arthur Cushing, and you need to go see him. And just be open-minded when you go see him. And I think so many people are so used to taking drugs throughout their whole life that they just don't. What's the word I'm trying to use?
They're sort of hypnotized by the pharmaceutical industry,
yes,
and the doctors, But in my practice, I see more and more people. It's an amazing amount of people who are rejecting drugs, or they're looking for alternatives. The drugs are making them sick. There's too many side effects. They're too expensive. There's so much wrong with drugs that they're looking for alternatives. And this is what we do here at the Holistic Center. We give them the real alternatives to drugs.
Right. I'm holding up your business card right now to the screen, Dr. Cushing, so everybody can see your phone numbers, your fax, your email, your website. I'm holding your business card up right now to it. So just everybody, please make note of this. My clients, people who don't even know me, you can trust Dr. Arthur Cushing.
Thank you, David.
Oh, you're welcome.
I really appreciate your testimonial there, and I appreciate your referring patients to me. And of course, I will continue to refer patients to you who have any kind of a mold or fungal problem in their homes.
Oh, thank you so much for the opportunity. It is my honor and it's my pleasure to tell everybody I know about what you do and what you offer, Dr. Cushing. Is there anything that you would like to add to this as far as what people can be more aware of, or their lifestyle, as far as changes that they can make or changes that they can consider in their life? And
well, I'll just say something in a general sort of way. A lot of people that I see have chronic illnesses, and they don't realize that the food that they're putting in their mouth is contributing in a major way to their illness. They have no idea.
Now, what is that expression? Now, I know what it means, but I may have some viewers out there who don't know what it means. What does a chronic illness mean?
A chronic illness, as opposed to an acute illness. Acute illness, is usually something that happens fast and is over fast.
Right.
You bump your head or something, you get a bruise, and it heals. Chronic illness is a complicated thing. It sometimes involves more than one system in your body. It doesn't disappear overnight. It is often disabling. It's often makes the person dysfunctional in some area of their life. The people with chronic illnesses, and we see a lot of them. There are autoimmune illnesses. There's gastrointestinal illnesses. We see a lot of people with gastrointestinal. What does that mean? It means things like gastritis, irritable bowel syndrome, peptic ulcers, GERD, and people, of course, with a lot of different respiratory problems. We see those all the time: asthma, bronchitis, chronic bronchitis, chronic cough that they have no idea what to do about. These are the kind of people that we see. These are the people that get very rapid help when they come to us.
Wow. That is very encouraging to hear, Dr. Cushing. And now, your significant other also does something as well, doesn't she?
My significant other, Rosalind, yes. She's British, and she's extremely straightforward and very empathetic. And she is working with us as a clinical hypnotist. She's a clinical hypnotist, and I'm very happy to have her working with us because there's a certain percentage of patients who need they have as an example, they have post-traumatic stress disorders of one kind or another that sometimes goes back many, many decades. They've never fully recovered from it. Medications didn't help them. Psychotherapy didn't help them. However, hypnosis, at least the version of hypnosis that Rosalind does, which is called regression to cause, where she traces the problems back to the original episode or person or circumstance and eradicates it at the causal level. This is something that I see a great need for, and when appropriate, I do refer patients to her for that purpose.
Now, can she help people, I think it's called PSD, is it PSD?
Yeah, post-traumatic stress disorder, post-traumatic, PTSD.
Yes. So she can help.
There's a wide variety of things under that heading. It covers a large amount of illnesses, post-traumatic stress disorder, ranging from the kind of thing that the Vietnam veterans and the Afghanistan veterans go through, to other things that are unrelated to war, things like very emotionally charged negative divorces, abandonment issues. These are all post-traumatic stress disorders that are pretty disabling to people because a lot of the emotions at the time of the trauma were not handled. So what happens is that when a person has a highly charged negative emotional ordeal and it's not resolved at the time, it just doesn't disappear. It goes underground, so to speak, and gradually starts unraveling the person on different levels. Sometimes it's psychological, sometimes it's biochemical, etc. But the difficulty is that a lot of people don't realize that that's what's happening to them. They've totally forgotten about some episode 10 years ago or 20 years ago that is below the level of their conscious awareness now. But it's insidiously unraveling them on some important level. These are the kind of patients that benefit tremendously from a few short sessions of hypnotherapy.
And then does something trigger it and they just go off?
Yeah, usually there's a trigger. Usually they don't even know what the trigger is. That's the benefit of seeing a hypnotist. The hypnotist will be able to relax them and get to the cause, the emotional cause that they've totally forgotten about, but which is still affecting them. The emotional cause is the trigger. But in their current life, they could be triggered by anything, but they don't know why they're triggered.
And it could be, as you say, it could be a separation, a divorce, a death of a loved one.
Yeah.
Oh my goodness.
Any kind of a significant relationship trauma, as an example.
Well, doesn't everybody have this? Doesn't everybody have a need for this?
Well, a lot of people do, A lot of people go through, in our society, very, very severe stresses, very severe traumas, and many people don't fully recover. That's why half the country is on psychotropic medication, They use pharmaceuticals to try to cover over, as a Band-Aid, those hidden wounds. So, yes, you're right. There's a huge population of people who are, let's call them the walking wounded. They're doing everything they can to function. But beneath the surface, they're hurting. That's where hypnosis plays a huge corrective role.
Oh, my goodness. This is so good to know about because I know so many people who could use this. The question is what can I do to people I know, Dr. Cushing, to get them to come see you? Do I need to say, are your medications working for you? Because a lot of times when I talk to them, their medications don't appear to be working.
Well, that's right. Or are they having significant side effects? Or do they just simply want to get off these toxic prescription drugs? Because a lot of people just don't want to take them. They know, they've already looked up the side effects, and they don't want to deal with them. You know, they put on one prescription, it has its side effects, and then they get another prescription to handle those side effects, and pretty soon the whole thing starts to snowball, and they're hooked on 6, 7, 8 prescription drugs. And nobody, no doctor, no medical doctor knows what taking 3 or 4 or 5 drugs together is going to cause in the human body. It's a big lottery game. It's a big biological experiment. How many people want to be the subject of a big biological experiment like this? Not if you're rational, you wouldn't.
Yes. This makes total sense what you're saying. This is, you have so much value to offer others, Dr. Cushing. So much value. And people just need, all you need is the opportunity to show them and to tell them what you can do. And this is why I wanted to do this for you, because you were so kind in doing this last year with me, and I am just trying to show others that how you have helped me and how you can help them.
Yeah, David, that's basically it. All they need to do, if they feel the need for it, is to just call us at 704-776-4185 and ask for an appointment, and we'll take it from there.
Oh, thank you so much, Dr. Arthur Cushing, and also thank you to your wife and what she does as well. And can you think of anything else that you would like to add to this?
No, I think we've covered a lot of ground today
Okay.
in a short period of time. So probably best to leave it at that.
Okay.
Thank
you.
If a patient has a problem that we didn't mention, just they can call me free of charge, and we can discuss it. And if I feel that I can help them, I'll tell them. If I feel I can't help them, I'll refer them to somebody who can help them.
Okay.
But just have them call me. It's a free phone call, and I'll be glad to discuss their issue with them.
Okay. Thank you so much, Dr. Cushing.
My pleasure, David. Thanks for taking the